Welcome back to the program. For more on our top stories and others, please visit our website channelstv.com and youtube.com/channelsweb. You can also watch us on the go on your mobile device. Log on to m.channelstv.com or download the Channels TV app for Android, iOS and Windows phones from their respective stores. And besides the news and updates, having the Channels TV app and Channels 24 app will give you access to more. You also have the eyewitness feature, so you too can be part of the news. Just install the app, then tap and swipe to reveal the eyewitness menu and follow the instructions to share those pictures, videos or news of happenings around you. And the Bayelsa Diagnostic Center was built to end the practice of Nigerians seeking medical attention abroad. After a significant upgrade of the health facilities there, the Bayelsa state government says the state is ready to cater to the nation's health needs.
This is an example of the delivery beds used to cross primary health centers in Bayelsa state.
This is the delivery coach. That's our toilet and bathroom.
Untidy environment, dilapidated buildings and obsolete medical equipment had been their reality for a long time. Many who had been forced to use these facilities. The disturbing experience is now a distant memory. The present administration has made positive investments in the state's medical sector.
I'm humbled and I feel fulfilled. I'm very happy that this project has come this way. Talking about the vision, our policy is to take Bayelsa to the world and to also bring the world to Bayelsa. And this is a cardinal program in that objective of our government.
The Bayelsa State Deputy Governor inspects the new diagnostic center, one of the latest feats in the Bayelsa State medical sector, and a project the state government believes will help end medical tourism.
Recall that we have one of the most modern diagnostic centers, built, equipped by this government. We have a drug mart that would make the manufacturers to bring drugs to our doorsteps. The issue of fake drugs would be a thing of the past.
The vision is to provide affordable and quality health services to all residents of the state.
And the kind of equipment that are being deployed in the health facilities that we've just shown you, you can tell that in terms of care to our patients, you can be sure that we are going into a different era in terms of medical care for Bayelsans.
The diagnostic center is a prototype to be replicated in all the local government areas of Bayelsa State.
And the United States Ambassador to Nigeria, Stuart Symington, has commended the federal government and agencies involved in the provision of care and treatment for HIV/AIDS patients in collaboration with the American Presidential Emergency Plan for AIDS Relief. The envoy gave the commendation after inspecting a laboratory and other equipment donated by the U.S. to the AIDS Prevention Initiative Nigeria, a public health initiative in Jos Plateau State.
The United States Ambassador to Nigeria, Stuart Symington, inspecting medical facilities donated by the American government to the HIV/AIDS Prevention Initiative Center in Jos, Plateau State, north-central Nigeria.
You can load about 3-4 racks, and once it's done, this is a docking system. Once it goes here, you can load others.
Since 2004, the Nigerian government, as well as other donor agencies, have been involved in providing care and treatment to patients in collaboration with the American Presidential Emergency Plan for AIDS Relief. Speaking at the end of the inspection, the U.S. ambassador says the importance of the antiretroviral drugs cannot be overemphasized.
Let me tell you the most remarkable story. I met a woman who works here who was HIV positive when she was in the university. She quickly got treatment. She was able to finish her studies. She then married, and she got a job here. And she learned how, by taking her medication to be sure that her children, when she had them later, would not have HIV/AIDS. She's had 4 children, and all of them are HIV/AIDS free.
This view is echoed by the CEO of the Public Health Initiative, as well as Lisa Patrick, a beneficiary of the program.
We now know, with all certainty, that if HIV drugs are taken properly, they do work. And when we mean work, they bring about remission. We don't talk about cure, they bring about remission. And what that means is that the person will look like you and I.
I discovered I was HIV positive, and then I came and enrolled in care through the support I got from the staff that were in the clinic, and then the support group that exists within the clinic. I had the hope, my hope was restored. I was able to move on in life. I took my drugs. I live well and healthy.
With an estimated 3.2 million people living with AIDS in Nigeria, experts say everything must be done to reverse the alarming statistics.
A fresh outbreak of avian influenza virus known as bird flu has resurfaced in Plateau State, north-central Nigeria. Over 40,000 birds have been destroyed by the Avian Influenza Control Unit of the State Ministry of Agriculture. Plateau State Commissioner for Agriculture and Rural Development, Linda Barrow, confirmed that 8 farms were affected from 2 local government areas of Jos North and Jos South.
It's difficult to know the extent to which farms in Jos North and South local government areas have been affected by this latest outbreak of bird flu. Since it was discovered, the Avian Influenza Control Unit of the Plateau Ministry of Agriculture and Rural Development has destroyed over 40,000 infected birds. This is to prevent infected poultry from getting into the markets.
The virus usually spreads by contact, and if such infected birds are being sold out to the public, the chances of this virus getting into free farms is very, very high.
In one of the affected farms along Zaria Road, over 6,000 birds were destroyed when the authorities heard that they were at the point of laying eggs. It's a huge loss to the owners.
Wow, you spend almost 7 million if you consider the feed, the salary for workers, and the medicine for the chickens. Almost 7 million has been gone.
The Poultry Association of Nigeria is seeking government's assistance in the form of compensation.
Currently, we're beginning to have government listen to our plight. There are very high-powered delegations and meetings that are currently being held with the government and stakeholders in the industry, all in a bid to fashion out a way out.
The word of advice to the poultry farmers is to patronize the Nigeria Agricultural Insurance Company to protect their investments.
Although I think that there's a policy that you must have above 300 or 400 birds before you insure them. But if you have that insurance, whatever happens, because by the time I came on board, I encouraged some people that please insure your birds. And about 4 or 5 people have benefited from that scheme just within the space of 1 year. You know, their birds were infected and destroyed, and then the insurance paid them.
Poultry farmers in Plateau State and other parts of the country have been placed on high alert to report cases of the H5N8 strain, so action can be taken to prevent further spread.
Meanwhile, in Ekiti State, the governor, Ayodele Fayose, says his administration is already taking precautionary measures to stem the rise of non-communicable diseases. The governor disclosed this while declaring open the 33rd National Scientific Conference and Annual General Meeting of the Association of Public Health Physicians of Nigeria in Ado-Ekiti, the state capital. He added that the state will study the outcome of the conference and ensure its implementation across the state. When the program returns in a moment, the Minister of Works, Power and Housing says he's not frustrating plans by the Lagos state government to construct or reconstruct some roads. Stay with us for details.